Hi, my name is Dr. Gary Furnett, and we're here today to create a chemotherapy teaching video to let you know more about chemotherapy and the treatment that we're recommending for you. This is a video that you can review multiple times during your treatment. You can share it also with family members so that they can be aware of the treatment you're undergoing and some of the side effects that can occur with chemotherapy. Cancer is a disease where there's uncontrolled growth of a cell within the body that ultimately creates a tumor. It also has the potential to spread elsewhere in the body. Chemotherapy, because it's given through the vein, has the ability to travel throughout the body and attack that cancer wherever it may be. Chemotherapy is sometimes used for curative purposes. It's sometimes used to prevent a recurrence of the cancer, and sometimes it's used to alleviate symptoms caused by the cancer. We also have targeted drugs now, which are sometimes used in addition to chemotherapy, which more directly attack the cancer cells and may have less effect on normal cells. We may recommend, depending on your disease and the stage of your disease, to add that to standard chemotherapy. Chemotherapy generally works by attacking rapidly dividing cells, and that certainly includes cancer cells. Now, there are some normal cells in your body which also divide rapidly, and that's where some of the side effects of chemotherapy can occur. One of the classic cells in your body that divide quickly are the blood cells, the cells that help you fight infection. And so there can be certain infectious risks that occur during chemotherapy. In addition, the hair follicle cells divide rapidly, and so some, but not all, chemotherapies can result in complete or partial hair loss. And your healthcare team, our team, will help let you know about those findings if they occur. Lastly, chemotherapy can also affect the GI tract, and nausea and vomiting can occur with chemotherapy, although some of the newer drugs that we'll talk about today have dramatically improved the way patients tolerate chemotherapy. So now I'd like to also take the opportunity to introduce to you your healthcare team, Ms. Terry Carpenter, Ms. Rachel Satchley, and Ms. Patty James. Well, Terry, we know that chemotherapy can affect the immune system. I was wondering if you could elaborate on that a little further.
Sure. With blood work, generally we tell our patients that we're always going to check their blood work when they come in, to the office for the chemotherapy. And we're looking for things, always checking electrolytes and the white cells and the red cells, so all the major things to make sure it's safe to get their chemotherapy. And then generally we tell patients that we're going to check them about a week and a half after chemotherapy just to see how their immune system's doing and if they're having any changes in their white and their red cells. And as far as the immune system goes, what we tell most folks is that it's common sense kind of guidelines. We tell people that the main thing is good hand washing, and then to not be around anybody that's obviously sick that you know of, if you can prevent that. And then if your white count is low or your immune system is down, we're going to let you know that, and then we're going to tell folks to sort of just be a little bit more cautious during that time frame. And there are some things that if the white cells are really low, we tell folks that we can help them out with that. There are some injections that will help the white cells if that's necessary, and that's done on an individual basis, so kind of person or patient by patient. And then as far as food guidelines, we tell folks that to wash their food, their vegetables well, and to cook their meats well. There are no particular restrictions, but it's sort of the common sense guidelines of making sure your fruits and vegetables are washed and your meats are well done. And then as far as the other parts of your immune system and the blood work, there's a part of the blood cell that does the clotting for you, and those are called platelets. And we tell folks, our patients, that if those are low, we'll let you know, and there's some guidelines that we have them follow for that.
So they tend to avoid things like aspirin or ibuprofen if their platelets are low, because they can bleed more. And I know it varies between different chemotherapy regimens, but in general, when patients' blood counts drop to their lowest level after chemotherapy is around 5 to 10 days after treatment. And so that's probably when they can anticipate coming in to get their blood checked to see how low they drop. Of course, not everyone drops with every chemotherapy regimen, so they may not really even have a significant immune system deficiency during their treatment.
Right.
Terry, you mentioned avoiding obviously sick people, especially when you think your white cells may be at a low point, which makes good sense. What about for patients during their ordinary activities during the day or the time they're getting chemotherapy?
Well, we encourage patients to continually to be active, to exercise as they feel that they can. They have done some studies and have shown that, being active and exercising do help fight fatigue and actually decrease some of the side effects like nausea. So we really encourage them to keep a normal routine and to try to exercise. Nothing harsh as far as exercising, but maybe walking and trying to do some things like that, but definitely staying active and a normal routine as close as they can.
Yeah, I think for depression too, in order to try to stay socially active is important. Most of the infections you get are from your own body, not from other people, especially if you're doing good hand washing and things like that. So there's really not a great benefit to staying sequestered in your home if there are things you want to do outside the home and remain active.
Right. So we encourage people to get out and to go to church and to do the things that they like to do and just use those good hand washing techniques and common sense guidelines.
Great. Terry, we've been talking about the decreased white cell counts that can occur during chemotherapy and the risks associated with that. Could you let a patient know what they should look out for and what they should do if they notice a fever during chemotherapy?
Well, when a patient's white count is low, we're going to let them know that in the time frame. What we want them to look out for is if they have any fever, chills, and we ask folks to get a thermometer and check their temperature maybe during that time frame. So if they're having chills and or fever and just feeling really flu-like, not feeling well at all, we want to call to the healthcare team just to check in and make sure that they're doing okay. And they may or may not need, medication or an antibiotic for that. So it's not an emergency situation, but it's something we really want folks to be in tune to and call us for that.
So Terry, there's a patient, for example, who's received chemotherapy and now they have a fever. Why don't you walk us through the steps of what they should do?
Right. We want them to call in, and we'll make sure that they have the correct numbers. There are daytime numbers that will get you directly to your nurse, and then there are 24-hour numbers. In the 24-hour number, there's a live person that you will get that will get the doctor on call. So we want the patient to call in and check in with the nurse and let them know what's going on. And if it's after hours, after 5, or on the weekend, we want them to call the main number, which is the 24-hour number also, and let the person that's taking the call, let them know what's going on, and they'll get the doctor on call to call them back.
So certainly a temperature greater than 100.5 or an unexplained shaking, chill, or other problem like that should be reported immediately.
Right.
Okay. The other thing that I think sometimes patients don't realize is, of course, every fever isn't necessarily an emergency or infectious. For example, some chemotherapies can cause fever, right?
Right. There are some drugs that we anticipate folks may have a low grade or even 100, plus temperature. We still want to call in so we can help them figure out if that's the case or if there's something else going on.
Absolutely, and I think that's the key point. Regardless of whether we think this is due to a drug or an infection, we always treat it as and want to hear about it as if it is an infectious fever, because we want to act on that immediately.
Right.
Rachel, I know one of the concerns many people have about chemotherapy are the difficulties that they might have with nausea and vomiting. And I think we've made significant strides in that area in the last several years. I wonder if you could expand on that.
Any of the majority of the chemotherapy agents can cause some nausea and vomiting. I think we are very, very proactive now as far as the medicines we give people. We will give them prescriptions ahead of time, to take, and we'll give them specific instructions on how to take the medicines. We recommend people actually continue their normal meal schedule, although make it more light. They will do better tolerating cool foods and things that are a little bit more lighter, kind of keeping something in your stomach at all times. If you try and do heavy meals, you get more of that bloating feeling, which can also add to your nausea. I think people overall have a stereotype of with chemotherapy that you think it's going to be awful and you're going to have a lot of nausea, a lot of vomiting. Yeah, you're going to have some nausea, but we do control it very, very well. Number one thing we want to do is make sure that you stay hydrated. If you are nauseated, you got to make sure you still try and push those fluids. Because you can get dehydrated very easily. We want to make sure we stay on top of that. If for some reason you're not able to keep fluids down due to your nausea, give us a call. We can always address that issue. Also, we can adjust your meds. If we've given you the prescriptions and you say, well, I'm still having this nausea, then we can do something about it. Just because we gave you one drug doesn't mean there's something we can't do to address that situation.
And Rachel, one of the things I think we often see are people who might be misinterpreting reflux and gastritis, heartburn in other words, as nausea. Would you care to comment on that?
Yeah, that's true. And a lot of people aren't familiar with a lot of the feelings they get with the chemotherapy. If they do tend to get a little bit of reflux, we recommend you can take either Pepcid over the counter or Prilosec or something to that nature to deal with the reflux, because a lot of times if you do have that, that's going to add to your nausea issue.
I've also often see those patients, for example, state that if I eat food, I feel a little better, and that's of course because the food is neutralizing some of the acid in their stomach, and so that's often a clue, I think, that patients may be having more symptoms of gastritis or reflux than actual nausea.
I agree.
When do patients usually experience nausea in relation to their chemotherapy?
I think it varies a little bit depending on the drug they get, but usually about maybe 3 to 4 days is probably their period where you got to kind of get them over that hump. Some people, everybody's a little different, so not sure how they're all going to respond to it, but some people, it may hang on for, day 4, day 5. Some do great, and just is tolerated quite well.
And many people have no nausea, as you just mentioned. What about in terms of the things that we do medically in order to try to prevent their chemotherapy, either before the chemotherapy intravenously or orally afterwards?
As far as
medications, delivering medications.
Well, they'll actually get some pre-meds when they get their chemotherapy IV when they're here with us. We give them a whole instructions ahead of time as far as how to take the drugs that we give them. We give them some PO medications to take at home. So we'll tell them, when to start taking the ones depending on their chemotherapy and what drugs they get here. We'll tell them like how to take it like day 3 or day 4 or when to start taking certain ones. Also give them some medicine to help them sleep at night because some of the medicines we give them during their chemo tend to keep them awake. So we'll give them some things that will help them, sleep, and some things that may cause some drowsiness. So that way they can kind of get over that hump a little easier also.
And you mentioned liquids. I think one of the misconceptions patients have is they have to eat solid food. And there may be more challenging days where, as you said, dehydration is really the enemy we're trying to fight. And perhaps just focusing on liquids those days, and especially nutritious liquids, if they can handle things like Carnation Instant Breakfast, Ensure, or milkshakes, or, in the worst case, even things like Gatorade or water. Just to stay hydrated is good, especially if you expect that nausea to pass relatively quickly within a day or 2. Well, Rachel, I know, we're also focusing on dehydration and how much is enough if you're being challenged by nausea and you're trying to get in enough fluid. What would you counsel people in terms of the amount of fluid they should be taking?
I would tell them at least to take a liter minimum. 1 liter to 2 liters is great. When we say a liter, like if you think of one of those soda bottles, like the Pepsi, the Coke, that's a liter bottle. So if you kind of focus on that, even if you fill that up with water and keep it, in your refrigerator so you kind of know what you need to drink. Just kind of as a benchmark that, okay, I will drink half this bottle, now I need to drink the rest before the day's over.
Great. And so dehydration, which is what we're worried about, can you talk about some of the symptoms someone might have with dehydration?
Some people become lightheaded, dizzy, just a lot of fatigue. Some people just, a lot of times their blood pressure is lower, so they just overall do not feel well. Not urinating a lot, just a lot of dryness in your mouth. Those are just kind of some of the classics.
And they'll often have more of a dark, concentrated urine, too, also. Patty, I know one of the real traumatic things that can affect people during chemotherapy is the possibility or actual hair loss. Can you comment more on that issue for us?
And this is a problem and a concern for not only women but men as well. And each chemotherapy agent can affect hair loss at different intervals, and some chemotherapy agents don't cause hair loss at all. Sometimes the patients may experience some scalp tenderness just prior to experiencing some hair loss. But generally it's something that they might experience around 17 days or so after the majority of the chemotherapy agents when they start. But that can vary, and some patients, as I say, may not experience the hair loss at all. They may notice that when they start having hair loss that they may want to go ahead and see a barber or a beautician and go ahead and have their hair shortened so that they aren't dealing with a lot of loose hair that can be problematic just in their daily activities. We encourage our patients, especially women, to go ahead and seek consultation on obtaining a wig. We provide you with a prescription so that you can submit that along with the cost of the bill for the wig to your insurance company, and most insurance companies will pay for those, and they call them scalp prosthesis. But you might want to check with your insurance company and your information to see if they do cover that. But by doing that, then you have a head start. You can match the color of the wig to your hair, and also the style, so that gives you a little bit more confidence when you go out into your daily activities. Your hair will grow back when we stop your chemotherapy agents. That's important to know. And generally the hair will start coming back within a month or two after that. And by the time that you're ready to come back, sometimes for your first office visit with the doctor, your hair will be back enough so that you've already had maybe a trip to the beauty parlor.
What about women who like to dye color their hair or permanents? When should they consider that after their hair is growing back?
Well, I've had this question is asked a lot because, you know, hair is a very important thing. We usually say 3 to 6 months after you stop your chemotherapy, then you can always start considering doing that. Your hair is still sensitive after you, and obviously that hair follicle, we need to protect that until it is stable enough that it can tolerate that. So if you have any questions, just ask us. Sometimes consult with your beautician. They are very knowledgeable and can use products that are not as harsh as others when you do start back.
I think when we first opened up the video, we talked about chemotherapy and how it affects rapidly dividing cells and therefore rapidly growing hair.
Absolutely.
And that generally would include the hair on your head. It would include leg hair, for example, especially for women. What about eyelashes and eyebrows? Women worry about that sometimes.
That is a big issue, and those can be affected. You can lose both your eyelashes, and maybe not in the total loss, but you can see loss of eyelashes. But you can see thinning, significant thinning of the eyebrows. And that is one of the things that they will help with the Look Good, Feel Good program, is they actually have teach you how to apply cosmetics in a way that looks more natural in terms of replacing the look of the eyebrow.
Patty, I know that we also have some support services often available for patients who have lost their hair, for example, with cosmetologists. Can you tell me more about that?
The Look Good, Feel Good program is a group of people who come to a setting and present information that is very helpful to all of our patients. They talk about the use of scarves and using wigs and hats that help to support any kind of needs that people would have during that time. Those sessions are scheduled, and we can let you know exactly where they're going to be and when they're going to be. And in your teaching pack, there's information that you can refer to with phone numbers that you can call to get local areas that are having them in a timely fashion for you and your needs.
Great. we know fatigue can be an issue with various chemotherapy regimens. Can you tell us more about how to combat that problem?
Sure. What we know about fatigue is we can control a lot of side effects, but fatigue is one that we really can't control ourselves. But there are lots of things that patients can do to help themselves with that. They've looked at fatigue with chemotherapy, and it's a different kind of fatigue. It's something the average person wouldn't probably understand necessarily. So we tell patients to really listen to their bodies, and if you need to rest, to make sure you rest, and that napping during the day is okay. A lot of people resist that urge to nap and rest. So we say that that's fine to do that sort of thing and listen to your body. We also know that exercise helps, so we really encourage patients to try to do some modest exercise, whether it's walking or some cardio or something that they can tolerate. They don't need to push too hard or anything that's going to really exhaust them. But exercise several times a week definitely helps fight the fatigue. We know that, and some of the other side effects. We also really encourage people to get a lot of sleep, whether that's 6 hours for you or 8 hours, and try to rest when you can. And as far as working your average working schedule or your regular working schedule, we ask folks to adjust that as they need to. So if they need to slow down and pace, depending on what they do for a living, that's absolutely normal, that they should do that for sure.
I know that, for example, with naps during the day, it's always probably a good idea to set an alarm because it's easy for a sleep-wake cycle to become altered.
It is. A lot of folks can sometimes nap for hours during the day, and then when they try to go to bed at night, they're unable, and then they're awake all night, and the cycle can be really terrible, and then they're exhausted and sleep-deprived to some degree. So definitely shorter naps we encourage, and like you said, maybe setting the alarm or having somebody wake you up after 30 minutes of napping, and maybe not more than once a day.
Yeah, I often see a problem where patients equate being busy with being exercising, and most people during their work schedule have these incredibly intense days, but they're not actually exercising, so that's not necessarily helping you combat fatigue.
Right, that's probably just adding to their exhaustion. We encourage people to take the steps at work if they can do that, to try to get out walking in the evenings or on the weekends. And that sitting behind the desk, if you're doing that sort of job, being busy is not exercising. So we encourage them to get out and walk. Seems to be a really easy exercise for folks.
And I know it varies with regard to the chemotherapy regimen, but if I'm getting treated today, about when would I expect fatigue to set in?
Takes probably 5 to 7 days, and people usually feel the impact of that about a week after their treatment. And we tell folks to look out for that. And sometimes it's mild fatigue. It depends on the patient, the age, and were they exercising before they started chemotherapy. All those things make a difference. So some people really have minimal fatigue. A lot of people have exhaustion, and a lot of it also depends on the chemotherapies that they're receiving. But that's probably a good time frame for everyone.
I also tell people it depends a lot on why you're taking chemotherapy. We mentioned at the beginning of the video, some people are taking chemotherapy to alleviate symptoms. And if those symptoms are very significant and the chemotherapy is effective, you may actually feel better while you're taking chemotherapy. Whereas if you're taking chemotherapy for a preventative purpose and you feel completely well, then you have to expect fatigue as a necessary side effect of the treatment, and then try to ameliorate it with some of the strategies you just enumerated.
Right.
Rachel, we know that changes in bowel habits can be a frequent problem during chemotherapy. Could you talk about some of the strategies we use with patients who develop diarrhea during their treatment?
Diarrhea actually is pretty common with a lot of the chemotherapy agents. We tell folks if they actually do get some diarrhea, they can take Imodium over the counter. If they have it and it's uncontrolled for 24 hours with taking the Imodium, we need to know about it because they can get dehydrated very quickly. Some people believe that they think if they have diarrhea they shouldn't eat anything because it's just going to go right through them. Actually, we do recommend you do eat some things, more kind of common things like known as the brat diet, which is bananas, rice, applesauce. Things are a little bit more binding. People can tolerate that. Also, we want to know if you are having a lot of abdominal pain with the diarrhea, any vomiting, any blood in your stool, anything like that. That's something that kind of raises a flag that you need to contact us about.
Yeah, I think if you're having vomiting that is unable to take in fluids and you're losing excessive fluids, that's certainly a problem that we need to know about immediately. Would you agree?
Exactly.
And tell me what kind of food you would recommend if someone develops diarrhea.
Okay, I would recommend things more like that are a little bit more binding, things kind of bland, more like applesauce, bananas, rice, sometimes toast, just kind of things that are better tolerated in your stomach also, but they also do help with the diarrhea.
And it's important, as I understand, to use applesauce and not apple juice, which can actually
Correct.
promote diarrhea. So
any of the juices can cause more diarrhea because of the sugar in them.
great. Patty, I know that constipation can be a challenging component of being treated with chemotherapy. Could you tell us more about that?
Constipation is something that is very important to try to avoid. Patients should let their healthcare provider know if they have an existing problem with constipation and what they do to help manage that now. Going without a bowel movement for 24 hours is something that needs to be addressed pretty quickly, and there are medications that can be obtained over the counter, and you can discuss that with your nurse to get specific indications as to what you might use. Missing a bowel movement on that second day really needs to be reported so that the nurse can advise you as to what you need to do to prevent any kind of long-term problems. Nutrition, adding fiber to your diet, exercise really helps to increase keep you regular on a daily basis. And also, if you're taking pain medications, those can certainly slow your bowels down and cause you to have some problems, and you may already know that from past experiences. So being well hydrated and also letting your nurse know if there's any problems with constipation is very, very important.
So early intervention, early reporting of those problems sounds like is a critical component of what patients need to do.
It's a very important component. You can spend quite a bit of time, and it's very uncomfortable if you have to deal with a problem that goes on for several days. So the earlier that we can help you manage that problem, the less problems you're going to have long term.
And some patients with their chemotherapy may have lowered white counts, so if they get enemas or things over the counter, they should let us know before they administer those because of a potential increase in infectious risk.
I discourage any enemas or any kind of rectal suppositories unless you do check with your nurse. She may want to check your blood counts to make sure that your counts are adequate before we even advise that kind of an intervention. So keeping them posted is very, very important.
Yes. that some chemotherapy drugs, not all, can produce mouth sensitivity or even actually mouth ulcers. Could you tell us more about that?
Sure. Mouth sores can happen with different chemotherapies. Not all chemotherapies will cause mouth sores. What we like folks to do is just to use a soft toothbrush and to avoid rinses that have alcohol in them or peroxide. There's a very good preparation that folks can use that's recommended by a dental team, and it's just salt and baking soda, warm rinse a couple times a day. So that's a very clean rinse for folks to use.
So you mentioned the baking soda and salt rinse. How would somebody prepare that rinse?
It's just a teaspoon of salt and a teaspoon of baking soda and mix it up in water, and you can do that several times a day, and that's a nice healthy rinse for your mouth. And a lot of folks make a preparation in the morning to kind of get them through the day so that they can just routinely do that several times a day.
And that's about in a quart of water, or?
In about a quart of water,
okay.
Yeah.
Are there any other medications that we can use for patients who develop painful mouth sores that are more problematic than the rinse is taking care of?
There are a few other preparations, and if you do have mouth sores, we want you to call in and check in with your team and let us know. There are a couple things that can sort of relieve some of the discomfort that are numbing preparations that can be called into the pharmacy. And sometimes the mouth sores can prohibit folks from eating and drinking, so we want to know if you're having, those sort of problems, to call in and check in with us.
And probably avoiding very acidic foods is helpful, although that may be common sense when the pain starts coming in, but
yeah.
you have to, as you said, listen to your body and know if you're having pain from certain foods like tomatoes, you'll want to specifically avoid those.
That's true. Juices and things red sauces, things that would have acids in them, the fruits and vegetables definitely will increase the discomfort or pain that you're having. And just depending on the chemotherapy regimen, some folks don't have any mouth sores at all. Some folks have a few. So we definitely want to know about those. And a lot of times, or sometimes, folks may need a little something to relieve the pain from that.
Sometimes people come in with things they consider to be mouth pain or mouth sores, and they actually have evidence for what we call thrush. Can you tell us a little bit about that?
Most people have heard thrush, and babies get it quite often. It's the white stuff that's on your tongue, and a lot of times folks can look in the mirror and look and see that they have it. It's very uncomfortable. It causes a bad taste, and it won't go away with just your general mouth care. So that's one of the things that if you see in your mouth or you think that you have, we want you to call and let us just take a look and see if that's the case. There are medications that will clear it up pretty quickly.
And as you said, babies get it, but also patients, for example, with a compromised immune system or who are taking significant amounts of steroids or prednisone may be especially susceptible to that?
Right.
Okay. Well, Rachel, I know a lot of patients some patients can be challenged with muscle pain during their treatment. Could you elaborate on that a little more?
Some of the chemotherapy drugs can cause people to get some achiness, usually about 3 to 4 days after they get treated. Also, some of the injections we give them to help bump up some of their counts, their blood cell counts, can also cause them to have some achiness. It shouldn't be anything that's, debilitating to where they can't get out of bed or they don't really want to do anything. It just should be like a mild kind of flu-like symptoms. People can go ahead and do massages if that helps, especially if they've done it in the past. We do recommend that they don't have the deep muscle massages. Also, if people do have any kind of arthritic condition, A lot of times the chemotherapy agents may make that a little worse.
Okay.
They can take some Tylenol just over the counter. If that's not helping and they're still having some, a lot of the pain, we need to know about it. And we can also give them, some stronger pain medication if necessary.
Great. Patty, we know especially women can be affected by hormonal changes during their chemotherapy, and in some patients like breast cancer, we're actually giving medications that affect the hormone levels. Can you speak a little bit more about that?
It's definitely, hormone changes is definitely an issue that can certainly can affect our patients, especially our female patients. Changes within having increased hot flashes, night sweats, and even some mood swings are not unusual to see and really need to be reported so that we can help manage these. Menstrual cycles can be actually interrupted, or they become sporadic. Any changes in major ways with increased flow or absence of menstrual cycles really need to be to let your health team know that so that they can help you deal with that.
And when you speak about menstrual cycles being interrupted, they can sometimes, of course, stop completely, especially if you're near your own natural menopause or depending on the chemotherapy drugs you're getting. Could you speak a little bit about infertility and chemotherapy?
Absolutely. In the case of infertility, especially in a younger patient, that would be a topic that definitely needs to be discussed with your healthcare provider, especially with your doctor early on in your therapy. If it's an issue that may cause complete possibility of inability to have children at a later time, it would be a topic that would need to be discussed early, and that would be something that may allow us to be innovative in terms of preventing any kind of long-term problems along those lines. During chemotherapy, contraception is very important. Certainly do not want to get pregnant during your chemotherapy. It could certainly be problematic in a lot of different ways. So you do need to make sure that you are following good contraceptive measures during chemotherapy, just to prevent any kind of issues along those lines.
How long should someone wait after receiving chemotherapy before having sexual intercourse?
Approximately 48 hours. That certainly doesn't eliminate being able to be close to your partner, being able to touch, kiss, sleeping in the same bed. That is not a problem. But sexual intercourse would be something that you would want to probably avoid at least for 48 hours. Also, if your blood counts are low, at some point your nurse or your healthcare provider may ask you to be conscious and eliminate or avoid that. If your white count is low or your platelets are low, that may be something that they would have to also include.
And so hormonal changes, as you began to mention at the beginning of our discussion, can also affect pain with intercourse, and women should definitely report that, because we do have some medications that can help with that.
Absolutely, and it's not a topic that's sometimes easy to discuss, but it's something that we can readily help with, so be sure and be upfront with your nurses or your physician and let them know. Also for men, fatigue, changes as far as narcotics and pain medications can also change your desire for certain activities, so being aware that there's a cause for some of these is helpful emotionally for a lot of people. So just share your concerns, share what's going on, so that we can help or reassure you or your partner during this time.
know whenever we're giving patients drugs or foreign chemicals or compounds, there's always a risk for allergic reactions. Could you tell us a little bit more about that?
Sure. Whenever anyone's receiving a new drug, there's always the potential for an allergic reaction, whether it's an antibiotic pill that may be given to you, or the actual chemotherapy infusion, or some of the pre-medications that we use, like Benadryl and other medications. Generally, you're being watched very well when you're receiving your IV medication, and we ask patients to let us know if they're uncomfortable, if they have any trouble breathing, if they feel lightheaded, or they feel hot all of a sudden. But they're being watched very carefully by an infusion nurse.
Are there some times when we can give patients medications prior to the infusion to help decrease that risk?
We do. There are certain medications that have, I guess, a higher potential for an allergic reaction. So we pre-med according to the physician recommendations for those chemotherapies. We give medications like Tylenol and Benadryl, and sometimes some other medications like Zantac through the IV to help decrease the risk of a reaction.
Sometimes even low-dose steroids, I assume, can be used either before the infusion or afterwards by mouth.
There are some medications that we actually have the patient start steroids at home before they come in, and that helps decrease potential reaction. So we watch folks closely and are looking for any, especially the very first infusion, any possible allergic reaction.
And usually that occurs fairly quickly after you've received the drug, allergic reactions to chemotherapy, for example. Is that true?
That's true. Usually within the first few minutes, if someone is going to have allergic reaction, it happens in the first few minutes. And with other medications, there are times that we keep folks for an observation period just to watch them for 30 minutes or an hour to just make sure that they're not having any problems with those medications they just received.
Okay. Well, Rachel, we've been talking about chemotherapy, and even today, the majority of the chemotherapy we give is through the vein, given intravenously rather than oral by mouth. Could you talk a little bit about the effect that chemotherapy can have on the veins?
A lot of the chemotherapies can be a little tough on your veins. A lot of them are irritants or stronger, so we keep a good watch on it when we're actually infusing the drug. Also, after the fact, sometimes you can have some irritation where you might get like a kind of a pulling sensation in your arm. We want to be real careful to make sure there's no infection starting there, so we always tell patients to let us know if you notice any redness, any swelling, any hot to touch, any signs of an infection, they need to call us. If it's just a minor irritation and it's just kind of bothering them a little bit but no signs of infection, they can just take some Tylenol for it. Even put like a cool compress on it, that might help.
Well, Rachel, I know many patients, we can just give them their intravenous drugs through a simple IV that can be put in and removed at the same setting during their chemotherapy teaching. But occasionally we have patients with more challenging venous access who may not have very good veins, or who are getting a chemotherapy drug that's especially an irritant. Can you describe what we might do in that situation?
Yeah, usually in those cases we'll have the patient get a central line put in, normally a port, which is really a minor procedure. It's done, under local anesthetic. You're just at the hospital for a half a day or so. There's really not a lot of side effects with it. Once you get it in, it may be a little tender initially, but after that, you can swim, you can shower, you can do everything you normally do. It's basically under the skin.
So usually what you're saying is we would have interventional radiology or the patient surgeon help direct the placement of that, and it's an outpatient procedure and usually without complication, but because of some of the functional challenges of those catheters, they can clot occasionally or give us problems. We don't routinely put them in for all patients.
Correct.
Well, as we know, there's a lot of rare side effects that can occur with chemotherapy that we like to make our patients aware of. Patty, one of the changes we see, especially with very specific chemotherapy drugs, are nail changes. Could you discuss those a little bit?
Absolutely. It sounds like a minor thing, but it's something that can be very problematic for the patients who actually experience problems with their nails. Most important thing is to make sure that you're not getting manicures or pedicures, that you're actually observing your nails, making sure that there's no redness or tenderness in the nail bed itself. We will let you know those drugs which are specific or would cause specific problems for your nails. But in general, everyone who is getting chemotherapy needs to be aware that they need to take good care of their fingernails and their toenails. Obviously, you want to keep your nails trimmed, and you also want to keep your toenails trimmed, but you don't want to get down into the cuticle or cause any kind of interruption in the integrity of the skin. Keeping your skin intact will be important because it's the first barrier against infection. If you notice that you have an area on your toes or your fingers that looks inflamed or looks like it's tender or has some infection, you would want to let someone know, because we would want to take care of that perhaps with an antibiotic, or at least address that in some fashion.
Absolutely, and we certainly discourage or do not want patients to use false fingernails or glued-on fingernails.
They can use fingernail polish, but generally that would be true. We would want, if they have false fingernails on when you come to the office prior to starting chemotherapy, generally sometimes taking off those nails can cause more damage than just allowing the fingernail to grow out and not to replace them and just clipping them off. Sometimes if you take those nails off, it can really make the nail even more tender. But not to obviously continue that process would be important.
Great. And Rachel, we know that certain chemotherapies or certain treatments can affect the bladder or urine. Can you talk a little bit more about that?
Yeah, some of the drugs are more tough on your bladder area, so we really want you to push lots of fluids. That's one of the major things we tell you, is make sure you still have that whole hydration factor. The better hydrated you are, the better you're going to be flushing things through, and the better you're going to keep your kidneys working.
Okay. Which some of the medications can also affect urine color, is that true?
Adriamycin is a big one. Usually after you get that drug, your urine will be red, which is pretty common. We expect it to happen. It shouldn't be like a bright red like actual blood. If that's the case, then we definitely want to know about it.
Right. And we often get questions from patients about staying out of the sun while you're on chemotherapy. What are your thoughts on that?
Well, we recommend to the patients that you can be outside and you can be in the sun, but we like for you to wear sunscreen, be protected with hats and long sleeves, and maybe not spend a full day in the sun. Even with protection, you're still going to get some exposure. You can definitely burn a little easier while being on the chemotherapies, and then sometimes actually have rashes from the sun or some sun poisoning.
And I think one thing we always try to emphasize to patients is, there are 75, 100, maybe more drugs that we call chemotherapy, and there are side effects which are quite common and can be anticipated and discussed, and there's going to be side effects that are quite uncommon or unusual. And so one thing we always stress to patients, I think, is that if you ever have a question and you don't know whether you should call, please go ahead and contact us. And there's always a physician in the office, so while you're getting an infusion, if there's an allergic reaction, they'll be immediately available. And then off hours, there's a 24/7, 365 physician available on call for any concerns or questions that exist. It's impossible, of course, in a video of this scope to address every potential problem that can occur, but certainly if patients are noticing anything that's concerning or unusual, they should contact us immediately and we can address it for them. We've probably heard the problem multiple times before, even though it seems unusual to them. So that's certainly a point I think all of us want to leave with the patients going forward. This This video is meant to be a guide to them, but cannot be all-inclusive, and we're available at any time for questions that may arise during their treatment. Well, we know that the diagnosis of cancer is in a very emotional time and challenging time for the patient. And, you know, the second hardest job in the home is that of the caregiver. They're often going to be the brunt of that emotion in some cases and have to be as supportive as they can be during that time. There's a few things that we've noted that really help patients. One is during the emotional time when you're meeting with doctors and nurses, it's always helpful, if available, to have a note taker, someone who can record the information as it's being given and be a second set of eyes and ears for the patient to help them accurately recall that information later. And this video is actually being produced in a way that will hopefully allow those caregivers, if they cannot be available, to review the information along with the patient when the appropriate time comes. Also, given the emotional time that exists during the diagnosis of chemotherapy, we often have and usually have cancer support counselors who are available at the Blumenthal Cancer Center, who patients and their families can be referred to if they're needing additional emotional support outside of what we can offer in the clinic. And that's an excellent resource to ask about and avail yourself of. In addition, many younger patients with chemotherapy have children. And except for very young children, we usually advocate that patients be gentle but honest in what's happening with them. And I think often patients and their families are pleasantly surprised at the way that children are able to rally around a patient or a parent going through chemotherapy and offer support and help. And it takes away some of the anxiety that might otherwise exist if physical changes are occurring that the child can't otherwise understand. So do know that while you're going through this process, your healthcare team is available to you for any issues or problems that occur, but also we can hopefully offer you the psychological support through the Cancer Center and other opportunities that will hopefully help you also do better during this difficult time. Well, I'm really pleased to have with us today Ms. Rachel Burns. She's our Chief Dietitian at the Blumenthal Cancer Center. Nutrition is such an important component of treatment and of chemotherapy, and also a challenging component. So I've asked her here today to answer some of the common questions that get asked by patients who are about to undergo chemotherapy. And Rachel, one of the questions I often hear is what should patients eat during treatment or chemotherapy?
Usually I recommend overall a healthy diet. I like them to try to choose plant-based foods, which would be like fresh fruits and vegetables, complex carbohydrates versus simple carbohydrates. And the complex carbohydrates are going to be more of those fresh fruits and vegetables. It's whole wheat bread, whole wheat pasta versus white bread or white rice. I also like to recommend lean protein, which is going to help to give them energy. Lean proteins would be more like turkey, fish, chicken, legumes, nuts, and seeds. And finally, I want them to make sure that they're doing healthy fats, which is typically going to be like canola oil, olive oil, or the omega-3s. Now, sometimes during treatment, certain side effects do take place, and so patients need to deviate away from that healthy diet. So an example I always give them is if their appetite's decreased, they're losing weight, and I said to watch us trying to do more of the good fats versus the bad fats, but they may actually need to do ice cream because that might be more of a comfort food for them.
Sure, I know it is for me. What would a patient do if their appetite does decrease during treatment?
Usually we want to try to think about doing like 4 to 6 small meals a day, something in their mouth every few hours. Always want to try to incorporate some form of protein, just a couple items every few hours, incorporating that protein. Try to do just sips of liquids when they are eating, and then do more of the fluids in between their meals because they're going to tend to get filled up quickly. Having easy things available to them so that they can just kind of grab it and eat it, because as soon as that appetite comes on is as soon as it can leave. Easy things might be like instant oatmeal, a pudding, a yogurt, a boiled egg, just something they can kind of grab and eat.
What are some, you mentioned protein as being an important part of the picture. What are some good sources of protein, of food that have a lot of protein that patients might focus upon?
We like them to try to do the lean proteins, which would be more of like your chicken, your fish, and your turkey. Eggs are also good, or egg whites. And then your dairy products. And then those patients that don't overall need a lot of the calories, I like the dairy products because you can still get the same amount of protein in like low-fat yogurt or non-fat yogurt versus whole yogurt. So the dairy products tend to be pretty good. And right now I'm tending to like Greek yogurt. That's a little bit more protein versus your regular yogurt. And then your legumes, your nuts, and your seeds. Those are typically going to be good sources of protein. Peanut butter. It's going to help to give you that energy to fight the fatigue.
And I know it's challenging during chemotherapy sometimes to, as you said, eat that broad spectrum of foods, and we'll also give patients recommendations for foods to eat after their diagnosis and after their intensive treatment during the sort of observational phase of their therapies also, in many cases. Sometimes we've talked about blood counts earlier in the video and how that can be challenging during chemotherapy. Is there anything that patients can do nutritionally in that regard?
Unfortunately, a lot of patients want a magic bullet for that food will bring up their blood counts, and there isn't anything set in stone. But overall, following that healthy diet that I talked about can always help. Also, trying to prevent weight loss, because those patients where they're having weight loss, their body is really working at that weight loss, so it's not going to have time to actually build up that healthy tissue and build up those good red blood cells and white blood cells. Protein again, and iron is a big one. You're always going to find iron in your meats, but then also you want to maybe try to think about like your iron fortified cereals. And vitamin C also helps you to absorb iron. So something that I always tell patients is maybe in the morning you do like an iron fortified cereal, and most of them are, and then have a glass of orange juice or have that orange.
Great, great. How about any other dietary supplements, herbs during chemotherapy? What's your view on those?
Cancer patients, they always want to try to take an extra supplement or an herb versus food. We need to be real careful and err on the side of caution when it comes to supplements. They do not have to be FDA regulated like food. So anybody can just make a supplement and put it out there and say it's all natural. And all natural doesn't necessarily mean that it is. I really promote more on your whole foods. No antioxidant supplement can give us what a whole fruit and vegetable antioxidant can give us. So trying to shoot more for those whole foods is most important. There has been certain supplements that have shown to affect the absorption of chemotherapy, and some of them may be forms of vitamin E, certain forms of vitamin C, ginkgo biloba, ginseng, St. John's wort is another big one, and black cohosh. So during treatment, it's those particular supplements, and those are just to name a few, that I definitely don't want patients to do, because they have been shown that they can affect that absorption.
I think it's really important. Sometimes when patients list their medicines, they don't think of these herbs as medicines and don't necessarily remember to tell their doctor about them. So it's important for them to list everything they're doing in that regard, so that the doctor can assess the perhaps negative effects it may have on chemotherapy metabolism or absorption, as you say.
Definitely.
Great. Well, Rachel, you've mentioned some of the challenges patients may have with their appetite during chemotherapy. Conversely, there are some patients who get an increased appetite during chemotherapy, and unfortunately, since we sometimes do better with nausea more than fatigue, they exercise less and are at risk for gaining unnecessary weight. Do you have any thoughts on that?
I think when the patient before they start their treatment, they should ask their doctor how their weight looks for their height, if they are overweight, because there are certain patients where maybe we don't want them to gain any more weight. There have been studies that show that achieving that desirable body weight and maintaining it prevents for recurrence later on in the long run.
Well, this has been very helpful. I think patients are going to really benefit from knowing what to eat, and I think many patients are ready and able to make lifestyle changes once they've had a diagnosis like this and adopt a healthier diet. And we'll certainly get them in touch with you later on also if there's additional things they can do after the diagnosis and treatment to improve their health. So thank you for coming.
You're welcome.
Great.